Hello friends, today I will take another cranial nerve, that is the glossopharyngeal nerve. Glossopharyngeal nerve is the ninth cranial nerve and it is associated with various functions, like it is the nerve which supplies the third branchial arch. So let us say this supplies the third branchial arch, or it is a nerve of the third branchial arch. Second, it is secretomotor. So it is secretomotor to the parotid gland. So let us say parotid gland, it is secretomotor. It supplies other parts like carotid body and sinus. Beside this, it will carry taste sensation from the posterior 1/3 of the tongue. General sensations are also carried by the nerve, that is from posterior 1/3 of the tongue, tonsillar region of the mouth, posterior most part of the tongue, again the pharyngeal area, and some part of the soft palate. So ninth cranial nerve do this multiple function, and that's why its name is given. Glosso means tongue and pharyngeal, that is pharynx. So it is a glossopharyngeal nerve. Like our previous video, we will describe the intracranial course, the course outside the cranial cavity. So let us go and draw a schematic diagram of the intracranial region. Now the 9th, 10th, 11th and 12th cranial nerve arises from medulla oblongata. So we should know this, and in previous video I have described that the 9, 10, 11, 12 cranial nerve arises from the medulla oblongata. The preceding 4 arises from pons and the preceding 2 arises from the midbrain. So I am drawing the medulla oblongata from the anterior side. So this is a ventral view of the medulla oblongata. So let us say this is my medulla oblongata. It has a median sulcus and there are 2 swellings just lateral to it. These are the pyramidal swellings. So let us say this is my pyramidal swelling. After that I have the olive. So olive will be a small elevation on either side of the pyramidal swelling. This represents the inferior olivary nucleus within the medulla oblongata. So this represents the inferior olivary nucleus. So I'll just label them here: inferior olivary nucleus. After that you get one more sulcus which will separate my inferior olivary nucleus from the another swelling. This swelling is called inferior cerebellar peduncle. So I just write down the full name: inferior cerebellar peduncle. So when you go lateral to the inferior cerebellar peduncle, and you will get the posterior aspect of the medulla oblongata. So we are on the ventral aspect of the medulla oblongata. So let us say this is the medulla oblongata, and that's the foramen magnum through which the medulla oblongata will come out as the brain, as the spinal cord. So let us say this is the lower part of the medulla oblongata and continuation as the spinal cord. So let us say this is my spinal cord. So we are seeing the ventral aspect of the medulla oblongata. From medial to lateral we had pyramidal swelling, number 1. Then we had swelling next to the pyramidal area, that is the inferior olivary nucleus, number 2. And number 3 is our inferior cerebellar peduncle. Now between the inferior cerebellar peduncle and the olivary nucleus, I get some nerve fibers which are the origin of my glossopharyngeal nerve. So these are the nerve which is originating and forming the glossopharyngeal nerve. So let us say I label them as 9th cranial nerve. Okay, so this bundle is the 9th cranial nerve. The 9th cranial nerve is just above of my another cranial nerve, that is the 10th cranial nerve. So I am just drawing the another cranial nerve which is the 10th cranial nerve. And this cranial nerve is very close to the 9th cranial nerve. That's why most of the area you will find that they are very close to each other. So let us say this is my 10th cranial nerve. My 10th cranial nerve is the vagus nerve, and before that I have the 9th cranial nerve. Okay, so it arises from the anterior aspect of the medulla oblongata on the upper part above the vagus nerve, between the pyramidal and inferior olivary swellings, by multiple rootlets, and these rootlets unite to form the trunk of the glossopharyngeal nerve. Now if I show you this on the lateral view, it would be like this. This is my midbrain, that's my pons, and that small swelling with continuation as medulla oblongata. Okay, now this is my track for the CSF, that's the 4th ventricle, and this one is the central canal. That's my cerebellum, and the lower part occupied by the medulla oblongata, and this comes out as spinal cord through foramen magnum. So this is the lateral view of my brainstem, and this is the ventral view of my brainstem. So again, in the lateral view, I'll show you the nerve arises and comes down as rootlets. These rootlets forms the trunk, that's the glossopharyngeal nerve. Now once the glossopharyngeal nerve is formed, within the cranial cavity, it along with the 9th, 10th and the 11th cranial nerve travels into the posterior cranial fossa and reaches the jugular foramen. Let us say this is my jugular foramen. That's my petrous part of the temporal bone. So I'm just drawing the petrous part of the temporal bone. That's my posterior cranial cavity. That's my sella turcica. I have the middle cranial cavity and lesser wing of the sphenoid with anterior cranial fossa. So we are seeing the cranial cavity, posterior cranial cavity, middle cranial cavity and anterior cranial cavity. So let us go ahead. The nerve, after coming out from the medulla oblongata, will unite to form the trunk. So I'll take the different color because it's not visible. So I'll draw this. Yeah. So let us say this is my nerve. This nerve unite to form the proper trunk, and then it will pass through a foramen called jugular foramen. So once it reaches the jugular foramen, this will show two dilatation below the jugular foramen. So let us say I am drawing the jugular foramen below. So let us say this is my jugular foramen. Okay, and you are seeing the nerve on the lateral view. So the nerve enters into it, okay, comes out and give two dilatation. These are called as the ganglion of my glossopharyngeal nerve. Now within the jugular foramen, let us say I am not accompanied by only glossopharyngeal nerve. So I redraw it and show you what are the other contents of my jugular foramen. So I just draw bigger. Okay. Now along with these two, I get the vagus nerve. So I'll draw vagus nerve behind it and the accessory nerve. So I have three nerves now. Those nerves are 9th, 10th and 11th. So these three nerves will come very close to each other in the jugular foramen. Now the vagus nerve lies just behind it and the spinal accessory nerve lies still behind it. Okay. Now all these nerves have their separate dural sheet. So they are not having a single dural sheet, they have a separate dural sheet. And they lie just below the jugular foramen. Now